And the Health Minister also talked about a change of policy being imminent in how we discharge patients from hospital who are recovering from COVID.
Yes, now this is politically sensitive for the Welsh Government, given what happened in the first wave of coronavirus and the spread in care homes. People were discharged without tests in those early weeks, if you remember. So what Vaughan Gething said is that there are currently hundreds of patients in hospital who've recovered from coronavirus and who don't need to be there, but currently can't be discharged because they keep testing positive. But he says there is international research which suggests that most people are not infectious for 14 days after the symptoms have shown themselves, yet they can keep testing positive. And the proposal is to discharge some of those patients if stakeholders and the Older People's Commissioner are on board with the idea. OK, Felicity, thank you very much indeed. Well, in relation to all of that, joining me now from Denbigh is the chair of Care Forum Wales, Mario Crefft. And Mario, as a care home owner, how do you feel about this scenario that Felicity painted there about someone testing positive for COVID, being discharged into a care home?
Well, what we've got to understand is that we've moved on a great deal from those early days that you described earlier, Nick. And what we've now got is a great deal more understanding of this. And we do know that there are many people that are languishing in hospital. And if we can safely, we need to get them out of hospital for their benefit. And also for the other reasons you've been reporting tonight, we've got to sustain the NHS here in Wales, and the social care sector is a vital part of that. So there is the possibility to have safe discharges. It isn't going to be a policy that will apply to every single care home and every case, but there are those care homes that do have isolation units. People would anyway come into those care homes and have 14 days in isolation. So it's early days with this policy. We're looking at the science, but we believe there are ways that we can safely discharge people in the future, and it won't be in the way that it was previously in the first wave.
Well, I wonder, in relation to that, you know, earlier in the programme we heard how desperate the hospitals are to free up space. Is there maybe a danger that in their desire to do that, you end up with people who may be in a position to infect others in a care home?
Well, you're correct in that. I mean, it is possible. And I think this is where trust is going to be absolutely vital between clinicians, our colleagues in the NHS, and of course, providers. It will always be the decision of the responsible individual, is the legal term, the person running and responsible for the care home, as to whether they can meet the needs of that person and indeed whether it is safe to admit. And I think there is clearly the case that there will be decisions made where it is not safe to admit. But as I've said earlier, there are organisations that are well geared up to relieve some of that pressure, and those isolation units are an ideal opportunity to relieve that pressure on the NHS this winter. So, you know, let's look at the science, let's work collaboratively. Safety has to be key. I have to accept, you know, safety has to be key, but it's also about making sure we can get people out of hospital where, you know, their general condition might not be beneficial for them. So it's not a one size fits all this. It's very much working with individual providers and ensuring that we can have a safe system of discharge that meets the needs of the NHS and our community.
Thank you very much. Mario Crefft from Care Forum Wales. Thanks very much indeed.
Thank you.